I am filling in for Audrey, so give her the thanks for bringing Scott here this morning. Scott Zarazee is with the Hoosiers Foundation, but he originally is from Michigan City in LaPorte County, is where he's originally from, and graduated from DePaul University with a degree in political science. He started working in the governor's office for Governor Mitch Daniels in 2005, in our little discussion here, and the time he's had with him, and I told him about my opinion of what he's doing here, and he says Mitch is one of the two smartest people he's ever had a chance to interact with, and I think he's done a good job here at Purdue. And the other one was Dick Lugar. Dick Lugar, I've had a chance to talk to Dick Lugar a few times too. In 2007, he moved to the Indiana State Department of Health to work in the Legislative Affairs Office. And in 2014, he became the Executive Director of the newly created Healthy Hoosiers Foundation. Today, his presentation is on the issues we have of infant mortality and smoking in Indiana. And from the research that I read and see about, we should all be very interested in where Indiana stands in this. And he's going to share with us, I think, create a sense of urgency why this is important to us and to our community. So please help me welcome Scott Zarazee here for this presentation.
Thank you, Rodney. I appreciate that. Afternoon, everyone. How are you?
Good.
Oh, I think we can do better than that. Good afternoon, everyone. So,
Get the mic closer.
how's that? Okay.
That's it.
But thank you for having me out here today, and I appreciate coming out here today. I've been going out visiting various clubs and things around the state of Indiana, and this is the first day where I didn't either have to drive in 85-degree heat with 100% humidity or just torrential downpours. So this was a great drive up to Lafayette today, so thank you for having me. And thank you for Rodney for that introduction, and thank you everyone for the hospitality I have had. My name is Scott Zarazee. I'm from the Indiana State Department of Health. I'm the Executive Director of the Healthy Hoosiers Foundation, which is a new foundation that we have just started at the State Department of Health to hopefully combat some of the health priorities that we have in Indiana. And so today I'm going to be talking about infant mortality and smoking in Indiana. So first, I want to let you know what exactly infant mortality is, how we define it in the state. So, and any child that dies before they reach their first birthday is considered to be under an infant mortality. So, mortality rate has only been below 7.0 3 times in its history. Yes.
Who are those? What are, we can't read the chart. What are the ones on the have higher rates?
So you mean less than Indiana or higher rates? Yeah, it's Ohio, West Virginia, Arkansas, Alabama, Louisiana, and Mississippi. So, as we say in public health, thank goodness for Mississippi, otherwise we would be even lower. So here's where we stand right now for the last few years from 2007 until 2013. So we look at Marion County, obviously that's our largest county, and we have the most births in there. So they go anywhere from 9.0 to 11.5 as far as infant mortality rates. And we'll see a later slide that shows why there's such a discrepancy in Marion County as compared to other places. But Indiana has generally been above 7.0 for the past 114 years. The U.S. rate has actually been going down. Other states have been doing a better job than we have in combating infant mortality. So that shows from 2013. I think as of 2014, the U.S. rate was right around 5.5%. So what are the causes of infant mortality? The number one cause of infant mortality in Indiana is low birth weight, and the number one cause of low birth weight in Indiana is pregnant women who smoke. That is direct correlation. If you smoke, you're more likely going to have a low birth weight baby. Number 2 is congenital anomalies. So that's generally something that is genetically wrong, not something that we can generally control. But number 3 is sudden infant death syndrome, SIDS. SIDS is almost entirely preventable if you follow safe sleep practices, and we'll talk about that in a little bit. So what is the smoking rates in Tippecanoe County? So the smoking rate among pregnant women in Tippecanoe County is 14.5%, which is 70% higher than the national average, which is about, I think the national average is between 8 and 9%. Pregnant women who are on Medicaid, so the people who receive public assistance, their rates have always been higher, and they are at 26.5, which is, so over 1 in 5 pregnant women who are on public assistance smoke. So those are people that we, as a state, through our Family and Social Services Administration, they have to come in every 6 months and re-up their services, but they have a much higher smoking rate than everyone else, although 14.5 is not exactly good either, and that is the main reason that I am here today in Tippecanoe County, is because you have such a high smoking rate, and particularly a high smoking rate among pregnant women. So you guys had about the 7th highest number of births paid for by Medicaid here in Tippecanoe County, and of the 6 counties that had Medicaid births, only 1 had a higher percentage of smoking women on Medicaid. So you are ranked number 2 in the county as far as women who smoke while pregnant. So here's kind of the reason why Marion County has so many fluctuations and why we have such a high rate of infant mortality and low birth weight in Indiana is mostly it's because of race. While the numbers for whites tend to go pretty much in a straight line, and for Hispanics pretty much in or the total in the straight line, and then for whites it's blacks who have much higher infant mortality rates than everyone else. While whites will have around 7.5, the rate among the black population is right around 15. So they have about twice as high as anyone else. So that's kind of where we are with smoking in Indiana, and what we're talking about today, which is smoking for pregnant women. So what is our solution? We got together as an agency a few years ago and kind of redid our priorities, said what is the problem, main number 1 problem in Indiana that we can tackle, that we have programs that are existing or ones that we can start up to try and tackle this. And so our main number 1 focus, and has been for the past I think 2 or 3 years, is lowering the infant mortality rate. So that's why we are looking at attacking low birth weight, attacking SIDS, and other things in order to lower the infant mortality rate. So one of the things that we have been doing in the state of Indiana is called the Baby and Me Tobacco Free Program, and I'll be talking about the Safe Sleep Boxes a little bit later, which targets SIDS. But the Baby and Me Tobacco Free Program, so this is another slide that kind of shows the percentage of women who smoke while pregnant. So Indiana, as of 2013, had about 15.5% rate of women who smoke while they are pregnant. The national average is between 8 and 9%. So we are almost twice as high as the rest of the country. The Baby and Me Tobacco Free Program is a program that was started in upstate New York 7 or 8 years ago. And do we have any doctors in here? Okay, I'm sorry, I'm going to talk bad about doctors in just a second. I don't mean to. There was a public health nurse in upstate New York who kind of looked around at her county and said, why are there so many pregnant women who smoke? This is the 21st century. If everyone knows smoking is not good for the child, why do so many of them do that? I've had some experience. We have several doctors. Obviously, our health commissioner is required to be a medical doctor, and I don't know if anyone of you have ever met Dr. Jerome Adams, but he's an absolutely fabulous person and has been a great health commissioner. He's had a lot of issues to deal with in the past few years, and he's done very well with that. But when you get doctors together, and I've been in meetings with them, and say, okay, how do we get people to stop smoking, especially while they're pregnant? How do we do that? If I got 4 out of 5 doctors would probably say, well, you just tell them it's bad for them. Well, if we just do a public campaign, let people know it's bad for them, that's what we should do. That's not how people generally react to things. We can have a lot of public education and tell them, but if just doing that, I don't know if anyone saw what I was eating, but there's a lot of starch on that plate. It's probably not the best thing for me, but even with me working at the Department of Health, I know that sometimes I don't always eat the healthiest. And if you try and tell people, hey, stop smoking, that may not be the best thing to do. So what this nurse up in upstate New York did is she did a focus group with these smoking pregnant women and said, why do you smoke? What can we do to get you to stop? And what came out of that was that they said, what would incentivize me to stop smoking is free diapers. And so she thought about it and said, what can I do to encourage that? So she came up with this program, which has now become a national program. Indiana was, I think, the 14th or 15th state to join in this. It turned out to be the Baby and Me Tobacco-Free program. So what it does is a pregnant woman comes in, wants to stop smoking. We help her to stop, put her through the program. After the child is born, for every month that she is smoke-free, she comes in and she takes a swab test, and we're able to within 10 minutes, tell if she has been smoking or not. If she is not, she gets a $25 voucher for diapers. So take that to Walmart, CVS, wherever, and get $25 in vouchers, or $25 in diapers. The nice thing about it is that if the father is in the house and he smokes too, if he goes on the program, stop smoking, he can also earn a $25 voucher for diapers. So a family could potentially earn up to $600 in free diapers a year on this program if you remain non-smoking. And what this does is the person who is statistically most likely to want to stop smoking is a pregnant woman. The person who is most likely to start smoking again is a woman who's just had a baby. Kind of makes sense. You have a baby, more stress, you go back to what you knew. What this program does is it captures you and helps you when you are most likely to want to stop, and then incentivizes you to continue that habit after the child is born. You are considered a non-smoker if you have not been smoking for 6 months. So hopefully after 6 months we have broken that habit of you smoking, and you are now considered a non-smoker. So we first implemented this program in Indiana in 2013. We got funding from the state legislature. I'm sure many of you know Representative Tim Brown, represents Crawfordsville, and I think he part of his area is in Tippecanoe County too. He's chairman of the budget committee. He is a medical doctor, works in the ER, so he is very familiar with how smoking adversely affects people. So we did get some funding for this through the state. And we started up 8 sites, and by 2015 we had 588 pregnant women enrolled in the program. 60% of the women were still not smoking after 6 months, which anyone who works in this field, if you can find a program that is 60% effective, you're doing pretty well. So what did we get out of that? we got our first numbers back in the end of December of 2015, and we had 245 babies born under the program. Statistically, we should have had 49 birth weight babies out of those 245 births, but we only had 4. So instead of 49 low birth weight babies, which is the number one indicator of infant mortality, we had 4. So that's about a 92% success rate, and that represents a $1.2 million cost savings for NICUs, to the medical community, to hospitals. They were able to, because of those babies not going in those areas where that represents a $1.2 million savings to the medical community. So after we had those 8 sites, we had enough money from the legislature to be able to expand up to it's 23 additional sites. So we have about 30 sites around the state, and you can see we target the areas where we think that this program is going to be most effective based on their rates of low birth weight, rates of smoking, especially among pregnant women. So that's where we put those programs. However, we do need some more, because we use the money up the legislature has given us, and so but we do need more. So what we have targeted mostly is in the areas that have the highest infant mortality rates. So this is just a slide that shows where the counties are that have the highest infant mortality. Tippecanoe does not have a high infant mortality. However, as I said, you guys are number 2 in the number of pregnant women who smoke. And those are 2 of our 4 top priorities at the State Department of Health. Is infant mortality is 1, reducing smoking rates is number 2. So what we have done is we kind of sat around and we said, how exactly, we know the money from the legislature is only going to go so far. So we had to come up with a way to try and figure out how can we get more money in order to open up more sites. We know these sites work. Instead of 49, we had 4. We have other areas in the state, like right here, that have high smoking rates, that we need to try and prevent that, because it's not just the mother and the father. That's now a child that is not growing up in a home that has that is around smoking. I was one of those. Everyone in my family smoked, and I was the only one that didn't. I didn't care. Every time I walked in the home in our home after school, big rush of smoke right coming right at me. Didn't really. I just knew I didn't like it at the time, so I never wanted to start smoking. It really wasn't until I started getting into this to see just what the costs are to us. They've estimated the costs of smoking in Indiana, I think, was about $1 billion. That's to taxpayers. That's for what we pay for through Medicare and Medicaid for people who have been smoking. So, you get to that age where you're on Medicare and Medicaid, and so what starts happening to you? Well, you get emphysema, you get lung cancer, and you are typically probably not paying for those procedures. You're probably on Medicare and Medicaid, and those are the ones that pay for that. So taxpayers are the ones that end up paying for a lot of people's medical bills on that. So what we did was we said, how can we get some more money in order to do this? And one of the things that we looked at was starting a foundation. Excuse me. So I was our legislative director at the time, and I did some research. I tried to say, okay, what other states have foundations? How do they run them? Is this a good idea for Indiana? What I found is that no other state department in the country has one. Obviously, these are nonprofits, so these are dollars that are not raised through the government. And that's what we were trying to do, is try not to, we know that going to the legislature every 2 years and trying to get our slice of the pie is difficult. They have many issues that they have to think about. It's not just us who's asking for money. It's state police, it's fire, it's schools, it's education. So we're all fighting the legislature for those dollars. And trust me, I understand. As a legislator, they have to decide where to put that money and how much and what are the priorities of Indiana. There's only so much money that they have to go around. So what we had to do was figure out, okay, instead of waiting for our slice of pie, let's figure out how we can grow the pie. And so what we thought was a good idea was starting up a foundation. So as far as I know, we are the first state in the country to be doing this. So this is unique, and it is relatively new. So we started up the foundation. We had to go to the legislature to get permission from them to be able to do it, and then I came on board in 2014 to be the executive director to try and educate everyone and go out there and raise some money. So we got IRS approval in March of 2000. That's Safe Sleep Box. We'll talk about that in a minute. So I started in 2014. We got permission from the IRS in 2015. I went out and recruited board members. The Healthy Hoosiers Foundation, as far as I'm concerned, must be a statewide organization. It cannot just be an Indianapolis, Marion County centric place. I am from LaPorte County, so I know that targeting those mid and rural counties are very important if you want to change the culture. We can have lots of programs in Marion County or Lake County or Allen County or Vandeveer County, but until we can tackle the Tippecanoes, the LaPortes, the Howard counties, and also the more rural counties, the Spencers, the Owens counties, we will not change the numbers of the percentage of people who smoke or the low birth weight much. We have to change the culture of how we think about smoking in Indiana. So that is what I have been doing, is going around and talking about our foundation. Excuse me. So what we want to be able to do is to open up 10 new baby and meat tobacco-free programs. So there's six listed here. We've actually added 4 more. One in LaPorte, Indiana. One in Grant County, Marion, and then Monroe County. So Martinsville, and one other one that's not listed up there. Each of these sites costs about $50,000 a year to run. What we'd like to, about half of that goes to salary, and then half of that goes to the vouchers. That would serve about 60 pregnant women a year. So that's what we're doing now, but I also want to talk to you about a new program that we want to be able to start, which is the Safe Sleep Boxes. Does anyone know what they're called? Baby boxes in Finland. Is anyone familiar with those? Finland has one of the lowest infant mortality rates in the world, and what they started doing in the 1930s or 40s was that every woman who's pregnant gets this box, and when she checks out of the hospital, and inside of that box is everything that the child needs for the first 2 months of life. So diapers, clothes, pacifiers, and then in the bottom of the box is a mattress, and that is generally where these babies take their first naps, where they'll sleep for the first time. And what it does is it helps to prevent SIDS, because one of the main causes of accidental SIDS is when the child rolls over, is when they sleep on their stomach, is that they roll over in the middle of the night, and then that can inhibit their breathing. So as our safe sleep coordinator at the Department of Health has beaten into my head, you should follow the ABCs of safe sleep, which is always on their back, or alone on their back in a crib. So I'm sure that we have all seen the cute pictures on Facebook of the dad, laying on the couch with the sleeping baby. He's sleeping, and with the baby sleeping on top of them. Those tend to drive the people who work in our maternal and child health program crazy, because that is not at all following the ABCs. One of the things that I learned from this is that I heard someone speaking, and she was speaking to a group of us, and she said that she was from Ohio, Cleveland, and she got a call one day from her husband, who said that their young child, Charlie, he had been sleeping with Charlie on his stomach. He had gotten home early and done that, and he had rolled over onto Charlie, and Charlie died. He was a cardiologist. She was a pediatrician. They knew better, and this still happened to them. So these are the types of things that are very preventable. And so they actually started a program. I think it's called Charlie something. Now I'm forgetting. But these are preventable deaths. So this is what the box looks like. What we want to do here in Indiana is start up one of these programs where we're going to find a county that has about 1,000 births, be able to distribute these, and then study how well they work, and then if it works, then we can do more of this. But what we are trying not to do is to go to the legislature and ask them for money, because that takes time, and it is unlikely that they would do something like this, even though we know it's good. But there are not the numbers, at least in the United States, that show that this is an effective program. So I've been talking to some of our Anthem Insurance, Amazon, and other places that might want to donate to this and start up this program. So those are the things that I have been working on for that. So this is what the Healthy Hoosiers Foundation allows us to be able to do. We can raise money from the private sector. We can go to these corporations that have an interest in public health, Anthem, insurance companies, Cook Medical, lots more out there to be able to have an interest in public health, to be able to donate to these. So health funds are more than likely going to be being cut a lot as we get up to over $18 trillion in debt. But one of the things that we can do with this is that we have flexibility over what the legislature does. If the legislature comes to says, here's your money, you must spend it on this, you must do this, you must do that. If I raise this money through the foundation, it's our board members that decide this. So I have a lot of doctors, I have a lot of some business people who have an interest in public health and seeing this happen. But if we find out, if we start one of these things up in baby me tobacco free in Tippecanoe, and after 2 years we find it's not working for some reason, smoking rates aren't going down, infant mortality hasn't changed, we can stop, and then we can move on to something else. So it also allows us to form some partnerships. One of the things that I've found when I come here, have you guys ever had someone from the Department of Health come in and talk to you? Or it's probably been a long time. I find that there is a lack of communication with what's happening in the private sector and what the government is doing. And so hopefully with this, me going out and talking, that I can be kind of a bridge, or our foundation can be a bridge between the public and private. So the Department of Health has we are basically a data collection agency. That's what we do. So, other foundations come to us for information, for health information, or, say, hey, we want to start this program. How would this affect, what does this do? We already do that. Everyone has to come to us. So we have this ability to do this. We're overseen by a board. The government does not decide where the money gets spent. The reason why we are doing the Baby and Me Tobacco Free program and the Safe Sleep boxes is because ISDH made a presentation to our board, and our board voted to support that with any money that we're able to bring in. So this is not the government taking more of your money and deciding where it's going to go. One of the advantages that we have at the Healthy Hoosier Foundation is that I am my expenses are paid for by the state. So that is their contribution to the foundation. So my salary and everything is paid for by the state. So any money that I collect from you here or corporations goes directly to the program, 100% of it. And so there are no overhead costs. And eventually what we'd like to be able to do is expand beyond the Department of Health. If this is successful over the next few years, to be able to, that's why we're called the Healthy Hoosiers Foundation. We can start doing bike trails with DNR. We can do a program with Department of Child Services about child abuse prevention. Those are the types of things that we want to be able to do. We're obviously starting with the baby and me tobacco free because I know that program works. I have numbers that can show that, and I also have real-time data I can collect. If someone comes in and does a swab test, I know if she fails or if she doesn't. So I know. So I give the reward based immediately upon performance. So I don't have to wait for something later on to see if this program is working. One of the things that we've been talking about that our commissioner talks about, Dr. Adams, is that health means business. I have friends who work in our Department of Commerce. We call it the Indiana Economic Development Council. I've talked to them and they have told me that when they go out, I think we've done a pretty good job of bringing a lot of businesses in Indiana recently, but they've told me that when they go out and talk to these businesses, the number one reason why a company won't move to Indiana is because of our healthcare costs. Because they will have to spend more money than they would in other places on an employee because we smoke too much, we don't eat right, and so they don't want to have to pay those they don't want to take the chance of those healthcare costs because someone who is not healthy misses work more. They are generally go to the doctor more, which costs that business money. So that's the number one reason why a business will not come to Indiana. So that's it's not just about public health. It's also about jobs in the economy. So here is my contact information. If anyone would like more information, or if you would like to make a donation to the foundation, you can go on our website, or else email me or contact me, and I can send you an address where to send that donation. But in addition to that, what I would like to ask from you is I've been going around to these 10 counties. Speaking to everyone that I can, and generally what I do is I go in and I try to talk to the hospital, the chambers of commerce, usually the community foundation, and then like the United Way or other charitable organizations. And those are probably the places where I'm going to raise the money to be able to start these things and maintain them. I don't know who those people are. You probably do. Please help me get in contact with them, vouch for, what we're doing here, and hopefully you support that. And I'm happy to go in and talk to them as many times as I have to in order to convince them that this is a good idea and worthy of their support. So that is my presentation, and I'm happy to take any questions.
Several years ago, the Extension Office at Purdue had a program called Have a Healthy Baby. And they went into the high schools and talked to the pregnant mothers there. Your statistics of money saved by this program, I don't know that they ever had that number, but just an underweight baby is normally in the hospital 1 to 2 months. So your figures are supporting theirs. Did you ever talk to anyone that had that program?
No, I've never heard of that program. Like I said, this is new, and we just decided in April. Our board voted for the Baby and Me Tobacco Free program, and we started discussions about the Safe Sleep program. So I'm relatively new at this, and this is my first attempt of what I hope I will be coming back here and talking to you again about things as we go forward. But I'm happy to talk to anybody at that over there.
The swab test that you do on the pregnant mothers, how
Yes.
often do you do that?
It's once a month.
Okay.
And
that tells you that she hasn't spoken the whole month? Or
Yes.
for the last week? Or
No.
the last 2 weeks? What?
The tobacco stays in your system for 30 to 40 days. So as long as we're testing them once a month, then we know if they how much they have been smoking.
Okay, and these vouchers that you give them, are they specifically in their name? I mean, it's just not a piece of paper that they can go and sell to somebody else for $10 because, they want.
Well,
It's in their name that they have to present ID to get the
I
diapers?
don't believe that, but you can only use this for diapers. So I would imagine it would be very hard for someone, or why would, I'm not exactly sure why someone would.
You'd be surprised.
Yeah, and trust me, I see the connection because in the legislature we talked a lot about methadone and heroin
You could sell
use.
it to another pregnant woman that smokes a lot for $10. Here, give me $10 and you got $25 to go get your diapers for your baby.
Well, one of the things that is if you are not smoking, it means that you've stopped some sort of drug addiction, because that's what tobacco is and is a drug addiction. It would be, I would think that it would. I'm trying to make the connection between someone who says, okay, I do heroin and I smoke. If I stop smoking, I can do more heroin by selling the free vouchers. So I'm trying to make the connection with that. Then maybe it's true, maybe it happens.
If I understand what you were saying, is Tippecanoe County had quite high rate of smoking percentage among women, but then a low birth weight.
Well, it's a low infant mortality rate.
Right, so, and if those two are intrinsically connected, how does that happen?
Statistics are, and those things are, we have a high smoking rate, and I can draw a correlation between high smoking rate and low birth weight and infant mortality. There are always outliers. So while you may have, and it also might be that there are some people who come to Tippecanoe County from the other counties in order to get their public assistance. So perhaps the child dies in another county. There are always outliers, and that's why. While we talked about if we were going to put Tippecanoe on this list of 10, that hey, they have a high smoking rate, they don't have a high infant mortality rate, or at least it's not as bad as others. Does Tippecanoe County, should they be getting this one? We talked about that, but in the end, you guys have such a high smoking rate among pregnant women. It may either you guys just got lucky, or someone is having their child somewhere else. But we thought that Tippecanoe County should be on that list.
Okay.
Maybe that's an indication our two hospitals are doing a good job with infants.
That could be. That could be.
Hey,
What is the cutoff that you consider an unhealthy birth weight?
That I don't know. I would imagine someone in our program, I can always check on that. And certainly it's different for different women. I mean, usually that's set by the doctor. The doctor says, well, that baby should have been 8 pounds and it was born 6.5. Or it could be, hey, someone should have had a 7-pound boy, 7-pound baby, and it was 7.5. So there are those fluctuations.
Let's thank Scott once again. We really need to go.
Scott, thank you for coming and appreciate your presentation, and it is very insightful. Let me give you this, our 100th year celebration this year, and actually this is a 2-year planner. Don't do it while you're driving, because it's in 2016 on one side, 2017, so perhaps you can use this and keeping track of your appointments that way. So thank you again for coming. Thank you very much.
yeah,